Atrial fibrillation. Now, that's another thing. Students say, how do I know the flutter different from the fibrillation? The flutter look like a sawtooth, so-called F wave. If we look at the atrial fibrillation, it's an uncoordinated atrial electrical activity that causes a rapid, disorganized, and uncoordinated twitching of the atrial muscle. So in atrial flutter, it is that it's beating very fast, so fast. But in fibrillation, it's actually just twitching. Just twitching. It's not a contraction, just a twitching of the muscle. And that's one of the difference between it. So if you look at this strip here, you can barely make out the P wave here. So there's no form of contraction going on. It's not that it's going fast, it's just twitching only, not doing a contraction. So what are the causes of atrial fibrillation? Most people with advanced age are seen with atrial fibrillation, valvular disease, pericarditis, myocarditis, and also amyloidosis, which is accumulation of protein in an area, and in this case in the heart, coronary artery disease, hypertension. Individual could be also congenital, that they were born with the heart disease, could be heart failure, hyperthyroidism, hypertension. Individuals, it's noticed that it's also seen in individual with obstructive sleep apnea. Could also be due to alcohol intake, acute, moderate, or to heavy ingestion, and they see that these individuals have atrial fibrillation. Individual who take in could be moderate, acute, or even heavy. So what will it look like when you're looking at the strip? Atrial rate will be 300 to 600. The P wave will be undiscernible, meaning that you cannot make out the P wave. Irregular palpitation. The person will have hypotension because remember, the blood leaves from the atrium to go to the ventricle. So if it's only quivering, that means that the atrium is not contracting to squeeze the blood out to go to the ventricle. And remember that the left ventricle is a ventricle that sends the blood out to the rest of the body. So with it just quivering, then the flow of blood will be decreased, thus hypertension. Chest pain may occur, pulmonary edema, and also the difference between the apical and the radial pulse will be greater, and also may have emboli. If the blood is just there quivering, rocking from side to side in the atrium, that put this person at increased risk for emboli. So what is the treatment? Electrical cardioversion, lasting less than 48 hours unless the patient is on Coumadin. So one of the things that they do too, why do you think that Coumadin would be a treatment for a person, or anticoagulant would be a treatment for a person who have AFib? They will also give amiodarone. They'll also give calcium channel blocker. They also give even beta blocker for individual with AFib, and they will electrocardiovert them to change the rhythm of the heart.